Hi there, this is Casey from the Non-Diet Yogi podcast. The following is a sample of the bonus episode I produce every couple of weeks for my Patreon subscribers. You can support my work and have full access to all bonus episodes, as well as other premium content, including resources and goodies from guests of the podcast, all by subscribing for just $2 a month at patreon.com/non-dietyogi. Thanks for listening, and thank you for your support, which keeps this podcast going without ads and without sponsors. I really do get why people in the yoga, wellness, and alternative lifestyle communities may be vaccine hesitant. At the beginning of the pandemic, I had and still have a healthy skepticism of these big institutions because it's true that bad things have happened in the past. Governments have been corrupted, pharmaceutical industries have prioritized profits over people in the past, and public health recommendations have been wrong before. For example, many people were perturbed by the misguided mask advice from the CDC early on in this pandemic. Initially, they told us that wearing masks wasn't necessary, before changing those recommendations and publicly acknowledging that wearing masks is a crucial way of reducing COVID transmission after all. They did this because even though they knew that masks were probably effective, they didn't want people to rush out and hoard all the masks, which, as we've seen, is what many people tend to do. And instead, they wanted to reserve the then limited PPE for the frontline healthcare workers who needed it most. But this lack of transparency really backfired. That was a mistake on their part, and it further degraded many people's trust in the CDC and public health recommendations at large. Also, recommendations can and do change over time as scientific knowledge progresses. That is the nature of science. Science is a process in which hypotheses are continually challenged and refuted sometimes as more evidence comes to light. And as more evidence comes to light, that can mean that certain recommendations do change. It doesn't mean that the initial recommendations were lies or that the public health bodies who were giving these recommendations were purposely trying to mislead the public. Also, I really understand why people have hesitated about this vaccine because they're worried about unknown side effects of the vaccine. And I get that. Disastrous results have come about from medicines that were not properly trialed, such as thalidomide. So thalidomide was a drug, or it still is a drug that's used in certain circumstances. It was marketed as a sedative and treatment for morning sickness in pregnant women in the late 50s and very early 60s. And this drug subsequently caused babies to be born with a range of disabilities. And by the way, that horrific chapter in medical history actually forced governments and medical authorities to review their pharmaceutical licensing policies. As a result, positive changes were made to the way drugs were marketed, tested, and approved both in the UK and across the world. So look, I really do get why people in the yoga, wellness, and alternative lifestyle communities may be more likely to be vaccine hesitant, or for a much smaller few, a straight up anti-vaccination. In addition, some people may have had bad experiences with the medical system in the past, or they may have even experienced some side effects or perceived side effects from other vaccines, or their children might have. And with all that said, when you look at the data, the statistics, which are widely available at this stage, they are incredibly compelling and clearly demonstrate that based on the fact that hundreds of millions of people are now vaccinated, the risk of any serious side effects from the COVID vaccines is extremely low, and the protection against COVID-19 is very high. The scientific consensus is solid, and that's the beauty of the scientific method. It doesn't leave it up to one person to tell us what works. It's hundreds of thousands of scientists testing and retesting hypotheses, drugs, outcomes, and coming up with an immense pool of data that is telling us this vaccine works. I must also add here that I'm not saying that no side effects have occurred from the COVID vaccines. They have, and that is not acceptable. And that is why scientists continue to research these vaccines to try to make them even safer than they already are. Many people who are vaccine hesitant will turn to holistic health practitioners for information about these vaccines. This means that naturopaths, herbalists, nutritionists like myself, and even yoga teachers are in a unique position to help reduce COVID transmission in our communities due to the common perception that we aren't in the pocket of Big Pharma, which of course we aren't. That's why, as a holistic nutritionist and student naturopath, I was really encouraged to see the naturopathic industry take a clear and firm stance on this after reading the editorial of the winter 2021 edition of the Australian Journal of Herbal and Naturopathic Medicine by Susan Arentz. In it, she states that, quote, politicians have limited reach in reassuring the vaccine hesitant, many of whom will no doubt be our clients and within our professions themselves. Rebuilding trust in the community is the main long-term solution for vaccine hesitancy. As health educators embedded within vaccine hesitant communities, we must take ownership of our role, draw on transparent and reliable sources, accurately interpret information, and provide informed healthcare to support our patients' individual health. End quote. I have definitely found this to be true, both in my work as a health practitioner and as a yoga teacher. The wellness and yoga worlds are rife with misinformation, disinformation, and conspiracy theories surrounding the pandemic and the vaccine. And it's exacerbating vaccine hesitancy and anti-vaccination sentiment. I know this firsthand because I am surrounded by it.